recording start कर रही हूँ. Can I keep this sample at front in the page change करना है तो? क्या introduce करूँ? हमारे इस series के start के लिए just one line. ये बोलूँ तो Hello everyone, welcome to our Pain and Power Talks. And this is our webinar series which we have started to educate and empower women to get better and strong at their and taking a charge of their health. Today's topic is to understand diastasis recti. So I'm going to get you to talk through what the diastasis recti is, how it makes a difference to us, and how how pregnancy is how we understand that whether it's normal during pregnancy and when to start getting concerned about it and taking action about. And then I will try to give you some tips and tricks how physiotherapists can help you with managing your abdominal separation or diastasis recti. So let's get started. So diastasis recti, what it is and what every new mom needs to know. What diastasis recti is commonly also known as DRAM or DRA in our medical terminology. In layman language, we call it more of abdominal muscle separation. And what actually it relates to, or what it means, is basically it is a separation of rectus abdominis muscle, which you can see in this diagram here. And actually it's not that the muscle is ripping apart. It's more of understanding how these muscles work. So basically diastasis recti is a six-pack muscle which we all are quite aware of, and which we see people who are doing a lot of gym work, they have those six packs showing up when they have done a very good workouts to build them up. So that is what is called as recti abdominis muscle. During pregnancy, or when we get DRAM, or when we get abdominal separation, what happens is these muscles, they are linked together by a fascia which is called linea alba. And when that fascia, linea alba, starts stretching out, our abdominal muscles start separating, and that is what you feel as DRAM, or as a gap and space where you feel like, okay, you those muscles are not strong. So, and this depression is commonly associated with pregnancy and postnatal issues, but it's not just limited to that. You can see abdominal separation in anyone who is more of like have a central obesity, which means like people who carry a lot of weight around our abdominal area, and are heavy lifters, whether it's related to work or whether people end up training themselves heavily with very minimal core engagement, they can end up having this abdominal separation. People who have respiratory conditions and they like asthma, or it could be chronic obstructive pulmonary disease, COPD, where they cough, and they don't have a good control on the abdominal pressure management system. This can also lead to diastasis recti. Another group which can develop this is people with having a connective tissue laxity issues. Who are naturally, their connective tissue can stretch more beyond normal extensibility, and they can easily have this abdominal separation. So now in today's webinar, I am going to focus mainly on pregnancy and postnatal DRAM, or abdominal separation, but it doesn't mean that we can't implement the principles to the other population who which I just mentioned before. So let's narrow it down to our pregnancy and postnatal people. So this is a slide I just was talking about, and I kind of like went ahead. So next one I'm going to, so this is summarizing, yes, people who can experience RAM is pregnancy and postnatal, people who carry excessive abdominal weight, who have central obesity, chronic coughing related to respiratory conditions, or people with connective tissue laxity. All right, moving forwards, and focusing this webinar towards pregnancy and postnatal recovery, I would like to go a bit deeper into what's considered normal during pregnancy and what's not, when we should get concerned about the causes of when we should get concerned about when to take action, when to see the health care practitioners to help you further. So let's start with what's normal. What's the difference between normal abdominal separation and when we start to start to worry about that? What happens during, let's understand what happens during pregnancy. Let's go back into dig a bit deeper into pregnancy. When we get pregnant, our body has to change. Our body has to accommodate for the baby, and also prepare us down the track for the labor. That's where our pregnancy hormones help us. What they do is, our pregnancy hormones are the hormones which kind of like help to support you through your whole pregnancy. I'm not going to go deeper into the names of the hormones. So to keep it simple and to understand it, what happens during pregnancy is our hormones are designed to create a little tissue laxity or stretchability. It is required to accommodate or create room for the growing baby. And later on during your labor, it prepares our pelvic outlet for natural vaginal birth. However, every female has varied response to these hormones, which could be due to our different genetic makeup. Some females can stretch exponentially to these hormones, and some kind of like have a very they don't get very lax with changing hormones. So in simple words, it is normal to have abdominal separation during pregnancy. It is basically your fascia getting stretched to accommodate the growing bub, and also, as I said, it's more of like, it is a need of pregnancy. It's not, nothing is breaking, no muscle is getting torn. It's more of like just your fascia which is getting stretched, and your abdominal muscles, recti, abdomini, they're getting a bit more separated. So now, coming to the next question is, what about the postnatal RAM? Or when we start getting more concerned about abdominal separation. So, if our body is designed to give birth, it's also has a natural way to recover from the pregnancy changes. First 6 months post in your postnatal journey, most of the tissues will start coming back to their normal state. When I say normal, remember that pregnancy goes for 9 months, 40 weeks. Our tissues do go through a lot of change. Yes, in these 6 weeks, our body has a capacity to kind of like uh, get back to get back to bit of normal base. So, for example, your uterus is getting back to its normal position. Your pregnancy hormones are out of the box, and your joints, your ligaments, and your muscles, they are going to aiming to get back to the normal stretchability, normal positioning. However, again, we all are different at our genetic makeup. Some females are very good at bouncing back to their pre-pregnancy bodies. Some need little help, and that is where we kind of like start to think about, okay, when we need to start seeing health practitioners, women health physios, to help you further with your postnatal abdominal separation. So this brings me to my next slide, which is more of like on how to understand the recovery and assessment. We've Women health physios or pelvic floor physios, we are quite trained and skilled to measure the DRAM, and you might have noticed that you sometimes in some hospitals, midwives can do a rough finger assessment, or physios who are on inpatient physios, they might be getting done some measurements using the fingers to give you a quick reference to the DRAM, and they might, if they consider that it's a bit more than the what needs support, they might give you a bit of help there, like giving you a bit of some referral or something to see women health physio or pelvic floor physio once at 6 weeks postnatal check. So when if yeah, so let's put it this way. It's hard to put everything in a concise way. Let's look at the time frames. 6 weeks to 1 year is a good recovery time for this abdominal separation, as based on the research. It doesn't mean that we can't do anything about if you are past that time zone. Our muscles have a quite good adaptability, but postnatally up to 1 year is the best time window to work on your abdominal separation, to get it a bit more faster. Now, and some females can naturally get the separation down to 2 fingers or less than 2 centimeters within 6 weeks of their postnatal journey, and some don't. Some females might have a DRAM which might be varying between 2 centimeters to 10 centimeters, and some females can get within first 3 months, if it's between 4 to 5 centimeters distance, they can bring it down to 2 centimeters, which is kind of like quite normal. But yes, from if you have a cosmetic kind of variations or concerns there, that is where we want to get it to 0. But then it's kind of like 2 centimeters is pretty good recovery. with your abdominal separation. So how, and that is where your recovery time frames can vary depending upon how wide the separation is. So now, common measurement tools, I would like to bring a little more attention about how its DRAM is commonly measured. As I said before, that it can be measured using fingers, tip of the two fingers or three fingers. It's like in midwives or in inpatient physios, they kind of like just use the fingers to tell you, okay, this is 2 centimeters and this is sorry, 2 fingers depth, width, 3 fingers width, 4 finger width. In clinics or at Procure when we do DRAM assessment, I either use vertical calipers to measure it, and I also we have this in-house ultrasound, which we use for measuring DRAM. Uh, why not fingers? Yes, finger is a quick reference check to assess. You can do it yourself as well. It's everyone's finger width can be different, so there is no quantification. If you're seeing me today and if you end up seeing someone else tomorrow or during your next consult, there is no quantification because my fingers are quite skinny, but other person's finger can be of my like 1.1 bit bigger. And so that kind of like doesn't quantify the DRAM measurements. Vernier caliper are good resource for me because if the DRAM is beyond 10 centimeter and if I use them, if they are, I can't get the DRAM measurement with ultrasound because it's quite broad, it's quite wide, and ultrasound can't get the whole picture into it. I don't use that. Then I don't use this. I preliminary measure with this, and then first measurement is always I do with vernier these calipers, and then I bring the ultrasound on board if I need to. Maybe and not in the first consult or second consult. It gives me a good baseline. Now, when we are doing DRAM measurements, it's not only about the width. We need to look into the depth as well. How deep how deep my hand is going in, because when we develop your rehab program, we need to work on both components. It's not just closing this distance, it's not bringing the muscles this way. We need to create a bit more of like sturdiness so that you can't just push in deeper with fingers. We need to get more work happening there. So these would be my tips on when even when you do a self measurement of your DRAM, you can use your fingers. It's quite handy, and it's more of like you can crunch a little bit and then you can measure how close those muscles can come to. It needs a little bit of practice to be a bit more accurate. And that's where pelvic floor physios or women health physios who are trained to do in detailed way, can give you more of a baseline readings, and then when we work through, we can compare it for future of how far you have come through, and it kind of like motivates you to keep working. Now, what are the common watch points? What else we need to watch when we are coming to your treatment part now? So what we need to watch, what are the concerns? Yes, we have a separation, how it makes a difference to us for postnatal recovery. You might have noticed when you end up getting out of bed, when you try rolling into the bed, when you try to lift your baby, or changing a nappy, or transferring them into the car, or kind of like unbuckling them and getting them out of the car, you end up seeing something or feeling something. It's kind of like something around your abdominal area. It creates a bit of dome or tent. That is what I would like you to watch. That is what we need to work on. When you are bringing any movement or any kind of like lifting in or changing the position, what's happening basically, why that doming happens. Let's go a bit more deeper in there. It's more of the pressure management issue happening in the abdominal, around in this abdominal wall area. And when that pressure is not managed well, it leads to doming. People with a bigger dram or abdominal separation, they tend to get bigger doming because that is the most weakest point at this stage. And when our pressure management is not working right, all the pressure or is going to get pushed through the dram, and it can delay the healing of those healing of that abdominal separation. So that is why that is one thing to watch when you're and that is the thing which we need to work towards in your rehab journey. Now, coming down to my next slide, the that is what we do in physio world. So helping you to understand how pelvic health physios, women health physios, how they can help you with your abdominal separation is the most important bit I would like you to take with you when we are working on your DRAM recovery journey. So let's understand how this abdominal pressure system works. So imagine your abdomen is more of like a canister. It has a lid at the top, it has a base at the bottom, and then we have a walls around. So the lid is your diaphragm, the breathing muscle. The base is your pelvic floor muscles, and the walls of this canister is your abdominal muscles, right? So basically, when we are looking at getting healing of your abdominal separation or getting these abdominal walls together, we need to work on this pressure management system in this canister, in this abdominal canister. Wherever there is a weakness in this pressure management system, whether it's the lid not working properly, whether it's your pelvic floor muscles, the base of this canister not doing a great job, or whether it's abdominal muscles, they are not ready to do what they need to do, that area is going to get affected. So that how we know about it, that is during your postnatal 6-week pelvic floor check with women health physio or pelvic floor physio is something very, very important. That is where we can get all the measurements and look at your personalized goals and create the treatment plan according to your needs, rather than just working. Everything is not for everyone, so it's more of like creating a personalized treatment plan for you. So that is why it's important to have a 6 weeks postnatal check with women health physio. First step, as we already got to know that what we do, we need to do the DRAM measurements, right? We need to measure those separation, and we need to also assess your pelvic floor strength. We need to assess your breath, how you move, how your breathing system, how your diaphragm, or how you breathe. And then we need to put all these things together in a right blocks to help you to get these abdominal muscles coming together. It is a journey. It is not a quick fix. If you have an expectation, you will go and see a women health physio, and on your one assessment, they are going to do some magic thing, or they have a magic wand. I wish I had, and it's going to bring you all your muscles together. You need to understand it took 9 months to get those muscles to separate. If your body was quite, if you fall in a window where your genetic makeup is like, you can have a naturally, you have a tendency to get your muscles coming together naturally, that's what happens. That's where the variation comes, where some females don't need any special support. But if you have where your where your muscles are not coming together, that is where you need to seek help from women health physio or pelvic floor physio, where they can address your breath work. They can get look at which uh, wall of that canister is not working properly, and give you a tailored program. But for now, to take home, I'm going to get you to start. First thing first is to start getting your breath work sorted out. Again, it's a pathway to your journey. Don't get overstressed if you can't get it right. When you do your breath work right, it's more of like you need to learn how to get into doing your 360-degree breathing. We might be using too much of our uh, up, upper upper zone, like upper traps, to kind of like accessory muscles to kind of like do a lot of breathing, because we had a limited space. So we need to get our system back. We need to focus on expanding our ribs, getting the breath more towards the back and side of your ribs. I'm not saying that nothing should work here, yes, but we need to expand the whole system. We need to get the diaphragm to do what it needs to do. That's the starting point where we can get started. And if you have any further questions, or if you want to have a tailored issues where these things you need to be assessed, I would advise you to go and see a women health physio, and get on board with this journey quicker and faster, rather than waiting for 1 year and then it gets little trickier and harder. The best window, as I said, is between 6 weeks to 1 year. It's easier and it's quick to get this recovery sorted. My other tip and advice would be, start seeing a women health physio during your pregnancy, rather than waiting for this postnatal recovery or postnatal review. If you have a good physio or women health physio who can guide you through your pregnancy, support you throughout your first trimester of your pregnancy to the postnatal journey, this is something which is going to help you to recover faster and quicker, because you will be giving, yes, you will be giving the support to those muscles from very beginning, where they can bounce back quicker. You will know the fundamentals which you can implement after your pregnancy, and get started working on them way faster than waiting forever. So that would be my other tip I would like to share with you. Now, another most important question is, there is a slide which comes to me is more of like, oh, what about if we had a vaginal delivery or C-section? Yes, the recovery or exercise prescription can have a little variation, but pregnancy is pretty same for everyone. You're stretching the same muscles. Pelvic floor is going to go through the same changes. It has to carry the same load. Your core muscles are getting separated at the same thing, and your breathing is kind of like affected in a similar way. Prescription of exercises and time frames can vary, but that is where the tailor plans come into picture. Introducing crunches, when to introduce crunches into your exercises, when to introduce core, when to start pelvic floor, when to start breath work. I've gone in a reverse order. It's not a fixed pattern. It varies from person to person, which we are working with. Some people might need more core engagement, some need to start with some modified crunches, or some need more of a need to work more on their breath work first before we bring anything else into the picture. So this would be my advice on how to manage your DRAM. And we are more than happy to assist you in future. If you have any queries, please email us or send messages on our Facebook channel, which is under the name of Procure Physio and Health Services. We will keep giving going forwards. We are going to keep putting some in post. Feel free to watch exercises if they're going to help you. Thank you for now. Good question.